Good morning friends. This is an unedited video showing double breasting technique of temporalis fascia. This is the temporalis fascia which we have harvested. Roughly it will be around 1 to 1.5 centimeters length and breadth. So this is a small cut which we have given to accommodate the malleus. This is for exteriorizing the malleus. So this will be the anterior flap and this will be posterior flap, and both will overlap each other. This will be double breasting. So the slit should not be exactly in the center. It should be nearer to the anterior border. Why? Because there will be less space between the malleus handle and the anterior medial wall. So this will be a smaller piece, this will be a longer place. Okay. And the next thing is, this will be up to the neck of the malleus. So our middle ear dimensions will be of this size. This part will come onto the floor of the external aortic canal. This will come onto the anterior wall. This will come onto the superior wall. And from here to here, this will come onto the posterior wall. So the length of the where you have to give the cut and how far you have to give the cut. That all depends. If it is tympanoplasty, maybe this much is enough. If it is a mastoid cavity with obliteration, then you have to take a bigger graft, and because you have to cover it to the superior wall, you have to give a deeper cut from here to here. With this technique, we are also exteriorizing the malleus. The main advantage of exteriorizing the malleus is if there is any epithelial remnants while skeletonizing the malleus, those will be lateral to the malleus and they will not cause any cholestoma. And also in the post-operative period, you will have a clear outline of the malleus as if it is in normal eardrum. After repositioning the TM flap, keep 1 or 2 dry gel foam pieces lateral to it, so that when mixed with blood, this gel foam will act like a sticker and make the temporalis fascia graft stick to the TM flap. Now TM flap and graft assembly is reflected anteriorly, and dry gel foam pieces are placed in the middle ear. These dry gel foam pieces, by virtue of their firmness, they will make the graft move towards the TM flap and stick to it. These also maintain the middle ear volume. Now place some wet gel foam pieces in the posterior part of the middle ear. This wet gel foam is Ciplox D impregnated gel foam pieces. This will take care of any residual infection or inflammation. Now TM flap is repositioned and dry gel foam piece is used to mop the TM flap and all its margins. See, now you should check the adequacy of tucking. So here we know that it's already tucked, but it is your duty to check it twice. So what I am doing is I am gently lifting the inferior flap, taking care that graft will not come. So I am lifting the inferior flap. So here, as I told before, this is the part of the graft that should come onto the inferior wall or the floor of the axillary canal. So here it is onto the wall and you are sure. Here it is coming onto the posterior wall. Here also we are sure. Now we are looking for the superior wall. See, here also this is anterior flap, this is posterior flap. Both are overlapping each other. Here, which to come first, which to come last? I prefer anterior flap to come after the posterior flap. Why? Because if the posterior flap comes like this, it will touch the superior flap. So to avoid that, I prefer first I will place the posterior flap and then I will overlap with the anterior flap. See, from here graft is onto the bone. From here it is not. Just check. There is small tag that is not allowing the graft to come onto the bone. So we have to release it. Cup forceps. Cup force. Cover pick. So now graft is coming onto the anterior wall also. So now I am replacing the TM flap. So from here graft is over the axillary canal up to here. So this is the virgin annulus. Here we are not sure. So for that what I am doing is I am pushing the graft more anteriorly. Dry gel foam. Now I will mop the face of the TM flap along with the graft with a gel foam. This is gel foam mopping. This will give a clear picture whether the grafting is adequate or not. Okay. Next, dry gel foam pieces are spread along the external aortic canal wall so that the TM flap will stick to the external aortic canal wall. Now dry gel foam pieces are spread over the TM and graft assembly side by side so that the entire flap lies in good orientation. Finally, EAC is filled with wet gel foam. This is a post-operative video otoscopy picture showing the eardrum in perfect alignment and the annulus is in its sulcus. So now you could understand why I am stressing about the gel foam tiling and gel foam lining so that the eardrum will be in good orientation. Thanks for watching.